It is 9 o'clock. We'll call the meeting to order. Please stand for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome. This is the regular April 14th, 2026 Commissioners meeting. Are there any additions to the agenda?
Mr. Chairman, I do have a couple here under the 10 o'clock home tax abatement. Please scratch the name Calvin Spront and add the name Lloyd Ward. Error I made when I did the agenda on Friday. And I have passed out for Kyle Evans at 10:15. The quotes for the humidifiers are on your desk. And on the back side, please delete the future planning needs from this agenda and that every future agenda. With that, that's all I have, Mr. Chairman.
Those amendments, I move the agenda. Second. All those in favor? Aye. Those motion carries. Consent agenda. We have minutes from March 24th, auditors warrants from March 27th, April 3rd, and April 10th. Commissioners warrants $340,148.55. And hospital warrants for $307,465.40. Motion to approve the consent agenda. I'll support that. All those in favor? Aye. Opposed? Motion carries. Nick?
Good morning.
Morning.
All right, first up for me today will be some project updates. First one being on the front page, the overlays and the 2025 project are scheduled to start shortly after road postings come off. They're doing some power pole work on 25 now. Things can change with both contractors are talking about right after postings. Next update would be the Osborne Township Bridge. We're hearing that one scheduled to start late summer. That has to meet the China restrictions anyway, so. Then my next update would be the last page. That would be the 2026 box culvert contract number 2. I'm going to talk about this a little bit here. That's the word. Next up for me would be requests to approve some right-of-way payments. These are culvert projects of varying size and varying amounts of fence, but nothing on these.
Just back up a little bit on the overlays. There's paint marks on some of this highways in Edgerton, so they're started getting ready.
Yep, that's probably our tech. Went out to marks limits on some of those projects, so that's probably what you're seeing. I mean, it could be. Without seeing it myself, I hate to say for certain that's what it is, but I know we sent our guy out to mark the limits, so. Yeah, so that's probably what you're seeing here.
Keep right-of-way payments are over.
Yes, yep, sorry, yep, culvert payments, yeah, I think they're township ones, yeah.
I'm supposed to approve the right-of-way payment. Okay.
I'll second.
Any discussion? Hearing none, all those in favor?
Aye.
Opposed? Motion carries.
Right, next up would be request to approve a culvert order, we're about out of certain sizes. Low bid was True North steel. These are galvanized and riveted. So I would recommend awarding the low bid from True North Steel for $17,479.56.
I'll make that motion, Mr. Chair.
I'll second it. Any discussion? Hearing none, all those in favor?
Aye.
Opposed? Carries.
Next for me then would be the bids for the 2026 box culvert contract number 2. Low bid was Midwest Contracting, $667,135. You can see they edged out A and C by a little bit, or a little bitter. all three of these bidders do good work. Well, no issues with either of them, any of them. Odd thing here, would be that, they all came in over an engineer's estimate. Which was $595,111. Funding's not a problem, we're usually kind of in low, so.
Go good with your electronic bidding again, that's. what
Yes,
this was?
yeah, it works really slick. I'm really surprised. I'm not a big computer guy, but even I wrote down last time how we did it, and then I kind of walked him through it this time, you know, saying what I would do. So I mean, I think I could probably do it myself if I had to, but
It's pretty smooth.
yeah, it's really slick. I really like it. Like I said, I think I've even got figured it out, and I'm not a computer guy, so.
That's good.
So it must not be too bad.
I think you mentioned funding. Would you maybe elaborate on it a little bit for the public here too, as far as how much the comes from Gregory Towns is not coming out of the levy for the most part?
Correct, it would be township bridge funds. For these, actually. I think it's even special town bridge, the amount we levy isn't affected by this, you know, we just levy for the local share. We make levy for the max of the local share. And then, you know, the rest is covered by that other fund, so it doesn't.
I just think that deserved to be repeated. So
No,
people understand.
You're right, I know about.
Yes,
but
we do.
I was like, no, well, I guess not everybody is. Yeah, no, that makes sense, so yeah, it's not gonna affect, our lending also. I assume that this is a result of recent fuel price increases. You know, we turned our estimate in. How many months ago, you know, when everything was really low, so you know, that shoots way up, but you know, they're bidding now.
Right.
So we did our estimate a long time ago, so that's. So I would assume that's part of it, so.
I'll make the motion to approve Midwest contracting.
And I'll second.
Yeah, are those two by Jasper, are they on the same road that the new quarry is gonna be on?
Yes,
But north of their
North.
highway? So they'll probably be going south.
it's my understanding that they have to haul south.
Yeah.
So we won't.
They won't be going over new culverts all. Right. If they ever get that far.
I wouldn't worry about that anyway, with their loads, these are built to handle that, so even if we did put them in and they ran over them right away. That's
Okay. Thank you.
Right, question? Not, all those in favor? Opposed, motion carries.
Right, next up for me would be some maintenance updates, last month, we've been. Doing a lot of crack sealing, everybody's favorite job for the year, but we're getting through it. Done a few ditch cleans. We had the pickup we ordered a while back from DeBoer is here. Just what we expected, you know, everything seems good on it, we had a good experience with them, so. So that's all good. But side note. We have a lot of corn stalks in the ditch, like plugging the culverts, I feel like it's. Oddly high.
So they come from the same place, the ones in my backyard did.
Yeah,
I've been to something else.
yeah, I don't know, it's just, I don't know if it's lack of snow cover or what, but I mean, it's. So if you see us out there. You might have to take care of some of them, you know, I suppose first big rain might flush some of them out, but. Might find the ones that are really.
I'm not 100%, I think in the past, where we had burned some out. When they were really bad, we had burned some, but then you gotta worry about,
Yeah,
burning restrictions.
Right.
So I know we have done that.
okay,
We've done-
we've cleaned a few out thus far that we know are problems, but like, oh, yeah, really everywhere, so.
Yeah, no, it'd be,
I-
I would just see what happens.
Yeah, that's our plan as of right now, we're just gonna wait till we get a big rain and see which ones fix themselves and which ones are a problem and kind of go from there.
Something backs up or something.
Right, but if you see us out there doing that, I mean, we're probably gonna spend some time doing it this year, kind of unusual, but. Whatever, that's the end result this year, so. So. Guess that's all I had, any other questions for me? I know I said I was gonna get a list of surplus stuff together, but I didn't have time to get to that, so. Still on my list, but I just didn't have time, so.
All right, thank you. That's good. Thank you.
Sheriff Stacy's not here, so she's still on the way.
Yeah.
So.
We'd like to find her.
Shuffle things around.
Sure. Personnel.
Morning. Employment status changes. We have one retirement on the report. This is for Melanie Verhey, or Verhey. She will be retiring, May 14th after 21 years of service. And I also wanted to open this to Commissioner Dan Golderman.
While we're on the subject of personnel, I asked Charlotte, if I have a moment to announce publicly that after 12 years, I decided not to run also. So my term ended December, then will be my last term. It'll be 3 terms, 12 years total, and I'm gonna miss it a great deal, and miss working with you guys as well too. We didn't always agree on everything, did we? We always worked well. We always worked well together, and plan to finish it strong. The main reason, really the only reason I'm doing it is, as you guys know, as a lot of public know, that my wife's health hasn't been very well. She's had some different issues and now fell into a form of leukemia. And I haven't been able to do overnight meetings now for the last couple of years, so I just don't feel I'm doing justice to that. And my priority is at home, so I want to make that public announcement as well too. And I encourage good people of Pipestone County to step up. There's good managers out there, and he or she would do a great job. I encourage them to step up and contribute to the community. So with that, thank you.
Thank you for your years of service.
Can you just enlighten the board and the public what your boundaries are?
Oh, sure. Yeah, I'm District 5, so I'm basically the south half of Pipestone, kind of. Highway 30 is part of the boundary, then it comes up to 2nd Street and then jogs over. You have to look at the map and see where jogs are a little bit. Part of the southern part of the fairgrounds is that, and I think, isn't the line right here at the north end of the courthouse that returns or goes to the east of the And again, as you guys all know too, it's great for the public. I serve the entire county, not just my district, just as you guys do as well too.
But you have to live in your district to run for your.
Yes. Yeah. Thank you for that, Allison.
I'll have some big shoes to fill, and I enjoyed working with you.
Nobody to replace one.
Open positions, we still have our jailer dispatcher, position open, accepting applications. And the IT technical internship, that opening has closed. Bill and I are reviewing applications and looking to interview that within the next couple weeks. Brief update on the HRIS payroll RFP. I'm still evaluating the proposals that we've received through that RFP process. We have scheduled vendor demonstrations for scheduling and payroll modules for April 28th with key staff participating. Final recommendation is planned for board consideration in May. And just a couple colleague kudos. First one, Derek Clark, Deputy Sheriff and paramedic, was nominated last month. He consistently delivers high quality service across both his deputy and EMS roles. He communicates clearly, supports teams without hesitation, and steps in to ensure seamless patient care during emergency responses. His calm demeanor, strong collaboration, and willingness to assist on short notice improve coordination and outcomes. He leads by example and strengthens trust across departments and within the community. And another colleague kudos went out to Liz Winslow, assessing technician, also nominated last month. Liz consistently exemplifies outstanding teamwork and collaboration. She communicates clearly and effectively, both in sharing information and actively listening to others, which helps keep everyone aligned and supported. She is always willing to step in and help wherever needed, regardless of how busy she may be. She approaches every situation with a positive and dependable attitude. Just a couple upcoming events. April 28th at the regular board meeting, we'll be recognizing employees with years of service milestones. May 3rd through the 9th is Public Service Recognition Week. And we will be having a Nacho Average Employee Appreciation Potluck on May 5th from 11 to 1 here in the community room. And we will be providing dessert in honor of employees receiving those years of service milestones. Any questions, comments? Thank you.
Commissioners are welcome to come to the potluck as well here. Good, come on in.
Are you using one of your personal recipes?
Go ahead and make some southwestern meatballs. Those good.
Yeah, mediation, that was yeah, we do the county calendar.
Sure. You'll find that at the bottom of your packet. Have Mr. Chairman, before you, board members, request for board action. Would be to approve change from an elected, coroner position to an appointed coroner position effective January 1st of 27. Dr. Christensen has informed me that he does not intend to seek re-election for the position of county coroner. However, he is willing to serve as an appointed county coroner. The coroner may appoint deputy coroners as needed. Sometime in the future, when Dr. Christensen decides not to serve as our appointed coroner, if he's chosen to serve in that capacity and wishes to continue to do so, the county can then choose another person to be the coroner, another doctor, have to be medically approved to do that. Or we contract with a medical examiner's office in the state, such as St. Paul Ramsey or Midwest Medical Examiner's Office out of Indiana County. A lot of counties do that as well, but they find that they can't and don't have coroners within their counties to do the jobs anymore due to time commitments and that type of thing. So what I have in the packet is a copy of Dr. Christensen's letter notifying the county that he is not intending to run for re-election as the county coroner, and also recommends the county follow applicable requirements to transition to a county position that is from elected to appointed. So what I have before you is resolution 59-19-26, which is resolution to fill the office of county coroner by appointment. This is the first stage action you have to do to make sure that we're going to appoint it instead of elected, and that way it does not appear on the ballot. We have to do this 6 months before the election. So basically June 1st would be our drop dead date to do this. So I think this would be a good time to do it. So unless the board has any questions, comments, or anything on this, the recommendation would be approved resolution 59-19-26.
I'll make that motion to approve resolution 59-19-26.
And I would second.
Any discussion?
I would ask Steve if he can maybe elaborate a little bit as far as how this compares with other counties and how the history of it, why we're making the change,
Yeah.
how other counties are interested.
Other counties have done the same thing very similarly. They've had appointed county coroners within their counties. And as those county coroners retire and move on, that type of thing, they have chosen to go with medical examiner services out of the metro area. St. Paul Ramsey and Anoka County are the two big ones. Mike and Haven and I have also had contact with the two health facilities up there to talk about that as well.
Yeah.
And both of those are willing to take us on if need be too. And there are fees involved. We're gonna have a appointed coroner. I would expect that we would pay a stipend fee for coroner call-outs, that type of thing, where right now there really isn't one. The appointed coroner can also appoint deputy coroners as well. So medical physicians at the hospital clinic wish to do so, if you could do that. I have been talked with the hospital clinic and getting negative feedback on the doctors wanting to be coroners out there based on their busyness and their workload and everything they're doing, so it'd be difficult to do that. So
So it's not like we got people standing line on this job. We're not taking the voice of the people away by making it appointed.
Absolutely not. It's a specific position. You and I, we can't run for it anyway because we have to be
The doctor.
the doctor, medical position, medical authority on that. So,
But we do pay for call outs now.
actually, unless Dr. Christensen turns anything in, but he hasn't turned anything in for quite a while.
Oh.
So
I mean, theoretically, you could.
theoretically, we do have money in the budget if there were call outs using other positions at the hospital. But to date, in 2025, we had zero, payouts for that.
Is he receiving a salary of
No,
some kind to
he's
be here?
not.
though?
No, he's not.
No, but he's not, hasn't had any, no, payments paid.
But I think he's done things.
Oh, yeah,
He just hasn't submitted the.
yeah, I've seen any bills come in.
Yeah, okay.
And how does that protocol work on that? He doesn't have to go to every death. It depends on, or how
They work very closely with law enforcement. Generally, law enforcement is the first call, so they're your first responders on death. Then the law enforcement determines then if there's something suspicious, that type of thing, then they would get the coroner involved and let them know. It always would be a call to the coroner anyway when there's a death, and the dead body, you need to make that communication with the coroner.
But it's not like there has to be a coroner on the scene every time there's a death before the body can be transported.
No, generally, the eyes and ears of the coroner are the deputies and the sheriff. And then they'll make that determination if they say, yeah, this is suspicious, we want the coroner here, or, even a death at a nursing home, right? I think they don't have to do that, but anything suspicious, coroner is involved.
I feel we're very fortunate, Dr. Christensen has been so willing to give us time to help us and again continues to do so.
And regardless of this, we would still pay for autopsies. Autopsies need to be transferred up to the cities, either to a county or St. Paul Ramsey for autopsies. And those you will see occasionally in your board packets on payments. So you'll see those $1,300, $1,400, $1,500, $1,600 for an autopsy. So those do happen.
An appointment would be easier for us to fill a vacancy in the middle of the year.
Yeah,
Instead of having a special election or.
correct. And it's very possible we get no one to run. And then we go through the whole process of here going to an appointment. This gives us more options.
Any other questions? All those in favor?
Aye.
Opposed? Motion carries. All right,
Thank you.
Casey and company.
Yes.
Go through.
All of us today.
Well, yeah, you brought the whole game.
Did you go to the commercial working?
We got it. We only come once a year, so we thought we,
You're gonna throw them, you're all alone, nobody wants to sit with you?
we'll come up in stages and phases.
Okay, I'll bring the other microphone.
Good morning, everybody. Thank you for having us. We have a lot to bring to you today, so we'll jump right in and move along, but if you have questions along the way, don't hesitate to ask. So in your board packet is our agenda with a few attachments with data. So the first page, I'm not going to read through all of this. This is just for you to have related, reminding folks of our mission, our county, our population with all 6 counties. Some folks have asked about poverty levels, so I included that. And then section 3 is just an update on strategic planning. We began that this fall, and we're moving along quite nicely. We've had 9 employee listening sessions. And right now we're in the, we've identified themes of those listening sessions, and we're moving towards goals and objectives. So hoping to have that to board in May or June for review. So then we'll jump into the meat of the agenda, and I'll invite Lisa, our business director, up here to give a audit and financial update.
Stacy, maybe for the people that aren't aware, even that we mentioned 6 counties, could you explain how Southwest was came to be?
Oh, I might need Nancy for all of it historical.
But the reason I
Yeah.
know,
Yes, so Minnesota is very, very unique. There's only a handful of states that are state supervised, county administered, and we remain one of those. However, rural counties find it very difficult as right, statute laws, both from the federal government and the state government become more and more complex. It gets more difficult to deliver those services to constituents. And so the unique and, really beneficial thing about Southwest Health and Human Services is we're, a joint powers of 6 counties. That being Lincoln, Lyon, Murray, Pipestone, Redwood, and Rock. And we're able to really, I would say, be experts in program areas and deliver those to constituents. I worked in Yellow Medicine County for a long time. That's a very rural county. And so when I first was out of college, I won't say when that was, I did all children's programs. So I was doing child protection, children's mental health, child welfare, licensing, and adoption. And I can tell you, you can't be an expert in all of those things. And so it was relearning every time you had to do a different program area, and that it's just administrative burden, time consuming, and not great for constituents.
Economy of scale.
Yes, yeah, absolutely. So this is a very important collaboration with all of our counties to be able to best deliver services. So, yeah, that.
And we've been a collaborative 6 county since 2013. So we're in our 13. So. Good morning, all. I'm here to present some financial notes. I just want to let you know, for the end of last year, we had an overall cash and investment balance of about 16.2 million. When excluding those designated restricted funds, we were right about 13.5 million. Our self-insurance fund was at 1,352,000. We generally held consistent there. It was down a bit at the end of the year. We did some claims and typical claims at end of year and did for baths, etc. Fund balance, our public health fund balance at the end of 2025 was 4.1 million. For human services, we were at 9.3 million. From a budget perspective, when we ended the year, we were 1% under budget for revenues and 8% under budget for expenditures. So in public health, they were right around 250,000 exceeding revenues, exceeding expenditures. They currently have about, at the end of the year, they have about 11 months reserve. So for human services, we were at 1% over budget for revenues and we were 2% under budget for expenditures. So we ended very well the year. Revenues exceeded expenditures by about 800,000. We currently only have about 3.25 month reserve compared to the state auditors, and they like to see us around a 5 month reserve. So we're still getting back our reserve. As far as the 2026 budget goes, we had union negotiations last year. We came in with a 2-year contract for 2026 and 2027 of a 5.5% salary increase for each of those years. And now in our agency, we're a little different. We don't have a step type system. That 5.5 includes any kind of increase plus any kind of COLA. So it's just a flat rate of 5.5%. So just to make sure you understand that. A lot of counties have step scales and situations where they have that and they have COLAs. So in our case, it's a one-time flat rate increase. So they did agree to continue the $3 differential pay for CP workers, CP supervisors, public health nurses, and public health nurse supervisors. We found that has helped us retain our CP workers. We haven't had a lot of turnover, so we've been very fortunate that we've been able to keep some consistent workers in that area, which is really good because it requires a lot of training. And it's good to have consistent workers in other areas too. For health insurance, we had an increase of about 9%. That's better than some other counties we had heard. So that 9% was evenly split across the employer and the employee. So each had half of that cost. Our current positions at the end of the year were right around 11 to 12. As of this last month or so, we were down to about 4 or 5. So we'll knock on wood there a little bit. We're kind of excited that we're not seeing a lot of turnover right now. Naturally, we have a few here and there with approximately 250 employees in our agency. So we're going to see a percentage of turnover. No new positions were budgeted on the budget. Again, I mentioned the 5.5% increase. The top mins and the maxes were increased by 2%. The $3 adjustment. Our health insurance costs, the agency, Minnesota paid them, medical leave, of course, was implemented. Nancy will look at the calendar. She'll have great details for you. there's a cost about that, so our total commitment was approximately 1.2 million. Typical IT requests, I'll let Evan cover those. We generally replace our computers every 5 years on a 5-year rotation. And naturally your spam and antivirus, and people will probably talk and mention that we're looking at Microsoft Office 365, looking at the details on that, because our current Office packages it ended in October of last year. So anyway, we're just carrying on. We currently have 34 vehicles in our fleet. We purchased out about 22 of them. We have 12 to go in the next 2 years. It was more cost effective to own them than it was to have with the fleet enterprise we had. As far as the levy goes, the human services levy, it was approved at 8% of 1,117,637. Total human services levy funding was 15,088,102. We're finding with the state that our allocations fluctuate. They've never increased. Like we always seem to get less dollars from the state. We also noticed our TCM rates have gone down, which is targeted case management. So any of our workers that meet with a client, or whatever, we get we'll call it a KISS. It's basically a target case management, and we get reimbursed for those. A child welfare target case management is going to bring us $377. That went down about $57. Our children's mental health target case management is at 905. That went down about 20, so we can maintain there. Adult mental health target case management, that's 611 for this year now. So it kind of is important that we get those hits, and then we also get that reimbursement from the state. Our final disposition has gone well since we revamped the policy on that, and we've been able to decrease our budget on that by about 50 to 75,000. Cost effective insurance continues to run about 1.3 million. What we've seen a large increase in is probationary placements and mental health bill drugs specifically. The costs there are anywhere from $1,400 to $1,500 per day. It's kind of a costly situation, but I'll let Stacy expand on that with her portion of the presentation. So our human services budget was 8% levy increase for total county contribution of about 15,088,102, and our total human services budget was 34,119,065. On the public health side of it, the levy funding stayed the same at $15.25 per capita. Total public health levy funding is at $1,123,021. We had nursing positions remain open, and that's just, they're hard to fill. I'll let Carol expound on a lot of the public health side of it. We've had some vet grants and other grants that she will expound on too. We have a cannabis substance prevention grant. Recently our DFC grant ended as a federal grant, that was the Free Communities grant. That was what you saw here. You saw mostly. That ended here at the end of October of last year. So basically their budget was at was a 15 quarter per capita and $1,120,025 of levy for a total budget of $5,081,096. So roughly our total budget is at $39,200,066.61. Mouthful. Do you guys have any questions for me?
At one point you mentioned a $3 surcharge. What was that about?
The $3 differential pay,
Yeah,
that's basically giving our child protection workers and some of our public health nurses a $3 differential pay on the base wage that they get additional $3. What we found when we implemented that a few years ago, we were having so much turnover in our child protection workers, and to keep them maintained and trained, we agreed, union as well as us, we agreed to do a $3 differential, and they agreed to that. So we continue that. That's not a permanent base. Has to get approved every time we do a union negotiation.
so that's just for that group of people.
That particular caseworker, that particular job description.
Yeah.
So.
Yeah, they brought the question to the board, and we debated it quite a bit, and again, because of the high turnover rate and difficulty placing people, we have a lot of vacancies for a long time. And then we have a determination to do it. It's kind of an inequity in the pay scale.
I think that in the last year, and Nancy can expand upon that too, but I think we had one turnover. I think one turnover in this, in 2025. The ways that we maintain our CP workers.
Do you still have vacancies though?
In other positions, yeah, I mean, turnover,
I mean, in that department.
not child protection.
Well, we do
Well,
have
right now,
currently 2 child protection supervisor positions
Just
open.
recently.
One of which was because Emily Pryor took the manager position that we created. And then the other one recently has left the office. So we are short 2 child protection supervisors, so that's concerning. Those are currently posted.
Of these budget numbers in your report, again, to point out that unlike we just had our discussion about highway bridges and so forth, we get a great deal of grant money for that. Our health human services makes up the biggest portion of our levy. I can't remember statistically what was the percentage, anyway, it's a large portion of it. Again, it's because it is our responsibility as a county to provide these services, but again, we're very fortunate that we do get both federal and state money to help administer these. And again, it's very important that our workers are very aware of that because of the cost captures and reimbursements we get. If they can document their time on these various things, we can get money back from the state on that, so it's important. So also want to point out, you talked about the vehicles we have. We talked about the big joint powers. There's 6 counties that make up this joint powers, or ourselves, Rock, Murray, Lincoln, Lyon, and Redwood. So you guys cover a large footprint, a lot of miles, and with that, a lot of challenges. And want to take this opportunity also to thank all of our people. Like I said, you got the gang with you. There's not a big gang back in each one of these 6 counties as well too. And without their dedication, we would be hurting. So pass that on to everybody. We do appreciate the work they do.
Absolutely. On a exciting note, the Senate omnibus bill just came out last night, and in it is changing our target case management rates from a one-time flat fee to a 15-minute increment, which could really increase our revenue. If that
Capture a lot more time.
So just a positive note on some of our state and federal funding that comes.
Hopefully they said that increment at a decent.
Yes.
Decent rate.
The omnibus was $45, so that's huge. Let's hope it was. Okay, anything else for Lisa? Sorry. Otherwise, I'll invite Nancy up. Nancy's areas of HR, income maintenance, and child support. Income maintenance especially has been a hot topic, as you know, with HR1 and SNAP and all the changes with medical assistance. So
Yeah, and this morning Stacy and I were already briefing on the omnibus bill as well, because some of the things I'm going to talk about maybe won't come to fruition or may not be as bad as what we thought, but fingers crossed. So I'm going to talk a little bit first about income maintenance programs. Again, that would be like cash assistance, SNAP, supplemental nutrition assistance program, healthcare, childcare assistance. I'll be honest, I've been in the business of doing in the income maintenance programs. I won't tell you what year, but I have never experienced the amount of changes that staff are having to go through with these programs. They are no longer simple. They are very complex. Probably the 5 biggest challenges that have been coming down on the programs, and I'm going to say the complexity of the programs keep changing. So one thing that we're seeing is workers are having to touch these cases multiple times. It's not like we have more workers. The same worker has to just touch that case more times in order to meet the parameters and the requirements of the work. Another thing that has been a bit frustrating is we found out through HR1 that we were going to lose 25% of our federal fiscal participation starting October 1 of this year. We had a calculation. We thought it was going to be about 600,000 in lost revenue. We did see another amount that was proposed, the state proposed, and it was 400,000. I guess I like their number better. But now in the omnibus bill, possibly we will be held harmless. So we'll wait to see how that goes. Another challenging situation for maintenance and for many of our programs has been the lack of modernization of systems. And so we will have to wait to see what really happens. By the way, Maxis is old. I actually worked on Maxis when I worked in the state of South Dakota. It was called Access at that time. So when I came from South Dakota and came to Minnesota, I knew already how to use the system, so, and I've been here a long time.
And what's the color of that screen?
It's green, it's DOS-based.
Yes.
So is Prism as well too, which is the child support system, and I think so is MMIS, so that's also another system. SNAP Air Rate has also been a very big area of concern and contention. Again, if the omnibus bill goes through, if we read it correctly this morning, I had to get through about 67 pages before I found it. Maybe they'll be holding us harmless, the state. But then the state will still have to pay that back to the feds.
Yeah, the omnibus bill has the state covering both the admin rate and the SNAP error rate for counties, so that would be significantly.
It's almost too good to be
Yeah.
able to leave, so we don't want to get our hopes up, but it would be awesome. The last thing, other large challenge has been non-emergency medical transportation. Supposedly, the state is supposed to take that over July 1st. And we have two, what we call transportation coordinators that administer that program. However, the RFP that was supposed to be done, the state just decided to no longer do that. And they believe, I've been told that they can just give it back to the counties, and counties are saying that this is what the statute says. So more to come with that as well too. My concerns about the state taking over non-emergency medical transportation is absolutely from a customer standpoint. I'm worried, how are they going to reach out? You know, they want to work with their local caseworkers and eligibility workers. We know who's going to probably be harmed the most by that,
I
so.
would question whether it'd be available.
Yeah, there's a backlog currently of getting constituents switched over on healthcare plans. And they're calling us and there's nothing that we can do about it because it's at the state and we're trying to find contact and ask the state for contact information. And they're not answering the constituents' calls either. So they're calling us, but we can't.
They're back 90 days plus. And this is harming clients too that need availability for healthcare. All we can find out is how many are in the queue and through what date. I think the last time the queue was 9,000.
Jim Prismal at Prime West, we talked about this at the last meeting, again, the same thing about the yo-yo back and forth, are they, aren't they, they're gonna carve it out. And his fears were the same as yours, how it's gonna affect our people.
So I'll jump over to child support. I should also say for income maintenance, we have about 13,500 cases in the 6 counties. So jumping into child support, we have about 2,500 cases in that program. And honestly, there hasn't been a lot of significant changes for that program, pretty stable. So I don't really have a lot to report on child support. We also manage the fraud prevention program. We have an investigator that actually covers our 6 counties, plus 3 others. And this is a grant that we have actually had since the mid-1990s. Yes, I was here during that time. Anyway, in addition to our 6 counties, we also provide fraud prevention services for Cottonwood, Jackson, and Yellow Medicine. Nobles County used to be with us and then last year decided to go on their own. Fraud prevention is rather prescriptive. It really has 2 requirements. It is to stop benefits from ever going out the door with a new application. And that's an application for public assistance. Or it is to stop the benefits from continuing if it is an open case. One thing, just to make clear, we do investigations of applicants. We don't do investigations of providers, which I think is a big deal when you listen to the news in the state right now. Their role is to have those investigations completed on average 15 days or less. I did hear from one of my maintenance supervisors that the state is looking at increasing that to 30 days or less. And then our cost savings for every dollar spent in the program, the expectation is that there is $3 in cost savings, and we have been meeting those requirements. Last year, I believe the total cost savings for the program, and I should say that's the state fiscal year, and that would have been ending June 30th of 2025 was $345,000. The last thing I'll just touch base on a little bit is human resource, which is another part of the agency that I am responsible for. I am seeing the labor market kind of softening a bit. Last year, anytime it seemed on average, we had around 10 to 12 openings. Today, we have 4. Now, interesting enough, we have 2 social service supervisors and child protection opening, which Stacy and I have been just kind of shaking our heads because, you know, in public service, it used to be people were chomping at the bit to apply for those supervisor jobs when they become open, and I'm just not seeing that with this labor force. So that I find that kind of interesting. In 2025, on average, it took us 28 days to fill our positions. We had 50 new hires in 2025, and 36% of those openings were filled internally. And so you know what happened then? I created another opening because we allowed somebody to shift and move in internally. But I do think it's an excellent way to support retention, because if you can keep that person at least with the entity, you can also keep that institutional knowledge. Also, since 2022, we've actually had 10 boomerang staff. I know my other board always likes when I talk about that, but people who left and then decided maybe the grass wasn't green, so they decided to come back, which I think is quite significant. Last year, our turnover was at 15.5%. That's a little high, much higher than I'd like to see it. I think 10% is about what I would consider to be a good number. If we took out, we also had 10 retirements last year. So if I took those out, we'd be at about 11%. And again, Lisa talked about, we currently are in year 1 of our union contract. She did allude that we don't have a pay grid or a wage scale per se. We have pay ranges. And one of our commitments with the union is to work towards the next, by the next time we come to the table, which will be in the fall of 2027, a proposal to go towards a pay grid. Any questions? And by the way, we're having lots of fun with Minnesota Paid Family, but overall, it is going well.
Are you having a lot of participation in that?
You know, I can tell you, I go in every day. We did not go with the state plan. We went with the private plan through MetLife. I don't know, using that too with Peter. Yeah, we're having, in my opinion, we made the right choice, because if that program is going to work, you need those payments to flow out, you know, be processed well, and the payments get to the employees. We've had 16 people apply since the first of the year. But we've also had, I think I've got 4 people already that have come back. You know, they use that 12 weeks right away and now they're back. So I'm hearing horror stories. I did a presentation for DHS on Friday on Minnesota Paid Family Medical Leave. I'm not really sure how that happened, but they had horror stories. People coming back and they hadn't even gotten a payment. We have not experienced that, and I hope you haven't.
Thank you.
Thank you.
Thanks.
All right, next on the agenda is a public health update. Going by Kara. No, that's me.
Good morning.
Good morning.
So on your handout, for the one side has all the programs listed, and I'm not gonna go through those all, but we serve from little kiddos all the way to adults in nursing homes, so, and everything in between. But those are the programs that we have. On the other side is I have some of the highlights from 2025 in Pipestone County. I have on there how many WIC families we served, and then how much money came back into the to the county from the WIC benefits, and that's specific to Pipestone County. All the other things that I have listed here apply across our 6 counties. Most of the programs that we work in don't stop at the county line, and so, they kind of go across all programs, but, I'm not gonna read through all these things, but we did a lot of really great work, across all of our program areas, and some of those numbers, if you ever have questions on those, you can definitely, refer back or give me a shout and I can help you out with some of those things. But like I said, we serve from birth, little kiddos to all the way to adults. We really, the goal of public health is just to get people healthy and keep people healthy. So whether we do that through car seats for our little kiddos or family home visits that we do, helping moms and families get a healthy start in life. With our WIC program, CDC program, that's a program that we work with that gets kiddos in to make sure they get their immunizations. And immunizations we really work with all the way through adults as well. Probably the biggest return on investment is in immunizations, especially in your older adults. Sometimes that can be up to, like if somebody has their pneumonia shots and flu shots, COVID shots, all those things that keep adults out of the hospital is really, it's like a 1 to 60 return on investment for your older folks. So, really important, and I'm sure you've seen in the news that, our immunization rates are going down. So we've got some healthy numbers on newborns, and some of those rates are down like 5 to 10%. And they weren't, in some of the counties, they weren't super high to begin with. And we are seeing, I don't have the exact number on measles, but measles is really concerning. And we actually had one last week and it was negative, so we're gonna go with that. But so if doctors are testing for it, what's out there. There was some cases in South Dakota that there was some tournaments and things. This was a few months ago, I think it was wrestling, but some of the kids that were impacted then, and then the schools got sent letters just to watch for that. And so it's kind of sad that hopefully the pendulum will start swinging back, but right now it's swinging to the lower
It's
immunization
not
rates.
just measles, tuberculosis is another concern as well.
Yeah, the good news about tuberculosis is it's a lot harder to get if you need like 60 hours of close contact to get it. So that's the good news on that. Measles is very, very contagious if you don't have your vaccine. So
Explain our acronyms too as you go through WIC, so everybody.
I'm sorry about, yes, we are terrible at that, right? So WIC is our Women, Infants, Children program, and that's a food support program. But really that program is also so great. It really connects families with other resources in the community. So our priorities then for this next year are really working on immunizations, getting out in the community. It's really hard to educate on that because it came kind of political and it shouldn't be, it's on health. So we have some work to do that. Our other prioritization for this next year are alcohol, tobacco, and other drugs. And did a little research this morning, see your cannabis shop is getting close to maybe opening up. So I'm not 100% sure on that, but the latest, it looks like you probably all know more about that than us. And then in the rest of our 6 counties, I think there's maybe only other one that is actually, no, I take that back. I think Rock County has 3 that are licensed and maybe 1 in Redwood. I'm 100% sure, but just the one license in Pipestone County. So continuing to work on that, and then mental health is always at the top of our list, and so continuing to work on that. And we have a wonderful program called Credible Mind. It's not the only solution, but it is one thing that we work on, and that we do presentations out in the community with businesses and different things, and an online resource for those folks that don't need direct mental health care, but maybe the step before that. So anybody have any questions on public health?
Can you say, or talk a little bit how the opioid settlement is going, or how that's
Sure, we are getting close to the, I can't remember if this is our third or fourth round of funding. Fourth round, yes, you must have on that opioid committee. Is there a meeting coming up on Monday?
Yes.
Yeah, so the board authorized another round of payments to go out and those applications were due Friday. And then the funding subcommittee is meeting next Monday. And then they will have recommendations for our May board to get another round of funding out into the communities, so.
Projects.
The projects.
400,000 spent so far.
Yep, and the projects range, like Western Mental Health is going into schools and doing work with kids. On some evidence-based programming. There's, I think there's home that, started up that's at, I don't know if it's a treatment or, I'm not 100% sure, I'm not in the weeds on that. But if you want more information on that, we can, yeah, we can definitely get you more information. But yeah, it's a wide range. I know there was some work done with the sheriff's departments and everything from harm reduction to prevention.
Did I also understand you guys are looking more actively for applications that there are?
Yeah, I haven't-
Here,
I know some applications trickled in right at the end of the weekend, so I'm not sure where they landed.
but we encourage you.
But we encourage people to apply for that. Yeah, we want to get that money out into the community. And speaking of that, there is a opioid summit, I believe it's May 13th, that will be in Wilmer, and there'll be different presenters on other things that are happening in the state. So maybe we'll get some ideas from that too, but commissioners are definitely welcome to attend that as well. I believe it's a Wednesday, so.
Gotta be hard though to do prevention for things that are becoming legal. So.
Yeah.
I mean, be just like for alcohol, the same way, you know.
Right, so how can we get communities to use that safely, right? Yeah, and get kids to not start until they're 26 when their brains are fully developed. So, yeah, that's hard.
One other project we're working on, which we're really excited about, and you probably have heard at AMC, is we're applying, we'll likely be applying for a grant for planning for a family resource center. So I know AMC has really had a lot of presentations and added in theirs, but it's really a resource for families in the community for them to go and find resources and services. So Public Health and Human Services, we're partnering on that grant application. So more to come on that.
Thank you.
Like 1 minute left of our time. So,
You're fine.
okay. There's a we'll do through. So we will move into human services. I'll invite Emily Potter up and just to introduce Emily. As a reminder, Cindy Nelson, who has been with our office, we celebrated 35 years at board last month. She was the social service director. And she decided to move into a different position in our office. And when that happened, the exec team came together to discuss that position. And we decided instead of hiring a director to hire a manager instead. So we have a children's manager. We hired Emily Potter, and then I'm covering the adult services now instead. So I don't know if you want to introduce yourself.
I'm really excited about my new role. As was mentioned before, though, we are down, unfortunately, to CP supervisors, and that's where I come from. So I'm still kind of navigating, overseeing my team, which is based out of Redwood, and then also helping with Lyon and Lincoln. So that's kind of been the priority. That's super important work, as you all know, and not something we want to get by the wayside. So once those are filled, I am super excited to fully step into this role, but it's nice to meet all of you.
So yeah, so our openings are in Lincoln, Lyon, Redwood right now for the supervisor position. So I'll just run through, I mainly put data in your packet around a lot of the areas. So if you move to attachment B, as Lisa indicated, our probation costs continue to rise. Last year, we were over $1 million in probation placement costs. And that looks like we're on target for that again this year so far. We don't have more kids in probation placements, but the probation facilities are charging more per day for the placements. We don't have a lot of control over that. We don't manage those cases. Those are all managed by probation. So, and obviously we can't always control, the crimes that are happening. But we're hoping to partner with, corrections and probations to think of, are there some solutions that we can think about to move upstream and prevent these placements?
So these are mostly juvenile.
Yes, these are all juvenile. Yep.
Share the situation we had a couple years ago where we had no place where we belong, we actually had people in offices.
That has been quite common across the country, is there aren't facilities, and so often social services has them in their offices or. The one concerning, maybe I shouldn't say concerning, but so there was a law passed 2 sessions ago that takes effect in August. That changes the age of delinquency from 10 to 13. So starting in August, any kid who commits a crime under 13, instead of going to probation, has to come to us. We don't have any resources or services, and we can't place kids in locked facilities. So we're not really sure what we're going to do. This session, we're having to carve out for violent crimes, that those would maybe still go to corrections, but it doesn't sound like anything is moving very fast at the legislative session. So we have a meeting coming up to meet with the county attorneys to start talking about how do we implement that. So that, I think we need to do more work around this area, especially not just because of the cost, but of course we don't want kids having to be in locked facilities or crimes being committed. So. Any other questions about that? All right, attachment C, I'm not gonna go into the weeds on this. These are just caseload sizes for children's. What I'll say is they're staying pretty stable, which is why we didn't ask for additional staff this in 2026. And then the next page is the adult social service caseload sizes, again, those are staying pretty consistent. Attachment D is our out-of-home placement data. So our out-of-home placements are really also staying stable, if not dropping. However, if you move to attachment D continued, you'll see the cost of placement, and that continues to rise. So even though our out-of-home placement numbers, our children in out-of-home placement are dropping, our out-of-home placement costs are increasing for the same reason as probation. They're just becoming more and more expensive. And I'll talk a little bit more about what's on the horizon of children's in a moment. I'll finish off these attachments. So attachment E, now we're moving into adult services. Wanting to highlight this because this is becoming great cost to counties. And a lot of cost shifts from the state to counties around adults on 72-hour holds and pre-petition screenings. So if you look at the bottom, you have the 2024 numbers. So we have 51 pre-petition screenings for adults to see if they are at risk to themselves or others and need to move toward the commitment. Last year we had 93. So we almost doubled the number of adults we were having to do pre-petition screenings for. So just a lot of significant numbers and increases in the mental health area for adults, and really expensive as well, right? So if an adult gets picked up on a 72-hour hold and can't be held in, let's say, the Marshall Behavioral Health Unit, then they have to go to Avera. If they're there past the 72 hours because of a court process, we pay $1,400 a day. And that's all county taxpayer dollars. And part of that is because our the health plans aren't picking up those costs. So just wanting to highlight that because that's a significant part of our budget. All right. So I'll go back to just a couple updates and jump in. Emily, I put this all together before Emily was hired, so I'm not going to ask her to help jump in on everything I put together. But there's some 2026 focus areas that I want to highlight, and I'm sure you've heard of them. The first is you might hear it referred to as the ACT or MAPA CWDA. So that's the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. But they make that anyone.
Speaking of that,
I know, right? So that was passed in session in 2024 with an implementation date of January 27th. This is another unfunded mandate. there is in the, again, in the Senate omnibus bill, AMC and NAXA have both been pushing for the legislation to fund this because it's going to be a significant increase in work for our staff. It requires active efforts versus reasonable, which is a higher standard. And it requires a number of service provisions that we have to do on every single family. I will say the hope is that this will decrease out-of-home placement costs. And if that happens, that certainly will fund it, but that takes a while to get to that point. So we're asking for this.
Want to require more staff to do the work?
That is our concern, that it will require, so active efforts, you know, we do active efforts for equipment stuff, so for Indigenous children, and we know that that takes probably double the work time for a family. We didn't ask for staff yet for this. I'm hoping in the legislative session we'll get some funding for that. So we're hoping to avoid increased costs around this act, but it certainly is a concern. We did apply for a grant that would have funded 3 staff. We haven't heard about it yet, but I have heard some rumblings that the state gave most of those funds to nonprofits in the counties. So I'm a little worried we did not receive that.
We were kind of banking on it too, because we applied not only as Southwest Health and Human Services, but we applied as a larger group of counties too, and I believe those 18 counties. So we're like, how can we deny 18 counties this funding and turn around and give it to one? And yeah, so we're a little disheartened about that.
It's a point. And we think that MAPCO will apply to probably about 80 to 90% of our families. So it's not just, even though the title has African American in it, the law requires us to provide it to families who are in poverty, families who have children with disabilities. And so when we look at our caseloads, we're thinking it's going to be basically all of our cases. I already talked about the delinquency age change. Another change in the law that we're working on is around educational neglect. So if you're 12 and under and you have missed 12 days of school, eight, sorry, it's been a while since I've been in this. 8 unexcused absences, you get referred to the county to help. If you help the family, make sure the kid is going to school. Those ages, it used to be a child protection response, and the law changed it to first offering a voluntary child welfare response. So we're just in the weeds around that right now as well, and working through that. And then there's just an increase around case situations with people who are undocumented and receiving more questions and calls, and what do we do if there's a child and their parents get picked up. You know, we're getting calls on those. So it's just, that's going to be increasing, I think, here as we continue on.
We've seen a recent increase too, in unique situations where we're trying to put people or kiddos with their family members, especially for like permanency, and we're unable to go through that process because maybe it's the grandparents and they're undocumented. So lots to navigate with this, because we know it would probably be the best place for them if they can't be home with their parents. But going through the licensing standards, definitely challenging.
Anything else for children's programs? Any questions about children's, or I can move?
That's on truancy. Do I understand that the truancy laws now have focused more on the parents' culpability as well too?
Yeah, especially for those that are under 12.
Yeah.
12 and older, they look more at it being the child's responsibility, but yes, yeah, that is accurate. And what you find in truancy is, you know, we get involved with truancy, but it's usually a lot of other things happening, not just a kid missing school, right? So it's a lot of times it's mental health, the kid struggling with mental health, maybe poverty, difficulty getting the kid to school. So there's always something underneath the truancy that is really what we're working on. I don't have a lot to report in adult programs. There's a lot to report in adult programs. What I'll say, so in the adult world, we provide adult mental health, case management, we provide med choices, which determines whether or not somebody would qualify for a waiver, whether that be for developmental disabilities or mental health or for physical disabilities to help support them in their community if they qualify, with the income standards. So what we know for Minnesota is we are on track to, have exorbitant amount of cost for waivers that we cannot keep up with as a state. When you see the graph, you can just see it exponentially increase. So last session, the governor said if we don't find savings in waivers, the counties are gonna have to pay for the difference. So there's a number of subcommittees happening right now that need to give a report to the legislature in December with cost savings. We need to find a lot, millions of dollars in cost savings. What that means is you may hear from your community, there'll be an increase both in eligibility, but likely in services as well, which will impact. So there's a lot happening around waiver at the legislative session, but nothing has, we'll see what happens in May and what gets passed or not passed, so. I think that is my main update in the adult programs. Any questions about that? Otherwise, I'll move to IT updates. IT has been a hot topic, I've noticed in the news, but is that right? No. No. There's been a lot, and there's been a number of schools I've also seen, I've had to throw people, not to make you nervous.
Yeah. You know, IT right now, a big thing is monetization with our state systems. The state has really let a lot of those systems stagnate, fortunately, and we're trying to advocate to try and get some of those systems updated. There is a lot of work being done there. The state, one of the biggest things we're trying to do for our workers is we have X numbers that are called. So in these systems, they gotta log in with these X numbers, and if they're working in a different county, they have to log out and log in with these different X numbers. And we're trying to, the state has afforded this to other joint powers, is a single X number for every worker, instead of having to go in and out of these systems with different logins. So we've been trying to pressure the state to try and get us to single X numbers for all of our users. Provide a lot of efficiencies as well as errors that we're not potentially, because it's getting entered in our wrong count. The other big thing with modernization that, you know, we're looking at Office 365. This will help us better integrate with the state. They've been that since, I don't know, a while. It's a big step to go to that just because of the money involved. So we're evaluating Office 365 heavily right now, along with AI. Bill here has been giving us a lot of actually good resources as he's been evaluating your AI policy as well. So we're in the process of evaluating that, as well as put two-factor authentication on everybody's local computer. It's just another security system to ensure that data breaches aren't happening.
A lot happening, and I should have said, Evan just started as the director of IT in November. So we were without an IT director for quite some time, so there's a lot of work to do. So we're excited. Any questions?
Appreciate you having on board, and you mentioned Bill, and of course, Richards and Ryan as well too. I know that they're very happy to work with you as well.
Yeah, I know they've been very helpful for me and a great resource for us to solve questions.
Did Bill warn you every time he comes to us with requests, we always sigh and say more money for you guys? The IT thing is absolutely great. It's very expensive, but very needed. And in the case of the point you mentioned, so the hacking, cyber attacks, it's so prevalent out there.
It does seem like modernization is gaining some steam this legislative session. So we're hopeful that there'll be some funds put towards some of these ancient systems.
We've been open for a long time, like talked about the health and human services computer system at the state level. Nancy, 12 years ago when I started, that was the hot topic at AMC, and it has gone nowhere to go. How long before I came on board, were they talking about it? Forever, since the 70s. Maybe it'll follow the same way the state's program for driver's license and license plates went. That was a fiasco too.
Yeah, that is a concern. I know that, we did get funding for our SSIS system, which is our human services, right? So our adult and children programs.
Yep.
And, in the last 10 years, every other state that has tried to, do their IT system, has failed. So we're a little nervous about that process, but we have the funding, and so hopefully that.
You talk about having to log in and out for each county and so forth, and the same thing with this system. I read that we predict that our workforce could actually be cut in half if we actually had an operating system, because of the duplication. You have to re-enter, and also that enters more opportunities for mistakes as well too. It's gotta be done.
That and the snap error rate, I think, would greatly decrease if we had modernized systems. Yeah, other questions for us? Otherwise, I really appreciate coming. Sorry for the snafu during the last board meeting. We had different days. But if you ever have any questions or want to know more about program area, please don't.
I'm glad you came, because we do committee reports at the end of this meeting, so now I don't have to go to health industry.
There you go. All here. All right, thank you so much. Have a great day.
Thank you. Amanda.
Good morning.
Good morning.
So, thank you with some updates and to the public hearing for one of the event applications we received.
Any motion to open the public hearing?
Yep. So, Chair, Secretary.
All those in favor? Carries.
All right, so we have received 3 applications, one for Kelvin Sprott. He has withdrawn his application because they were ready to start, and so we don't need to address that one has been withdrawn. But we have 2 applications for Lloyd Feld and Lloyd Sport, and have their applications. Both of them are building on empty parcels that are not replacing any current structures. So, let's see. I don't know if you guys have a preference as to looking at one first. I have Lloyd and Janice Feld in front of me. So, and both of these are in Edgerton, city of Edgerton. Lloyd and Janice Feld's the estimated new home only value is $349,400. So again, estimated abatement, and that's based on this year's rate. So once it does actually get paid out, it will change within the year. And then the value will also change as needed. But the estimated abatement amount is $1,105 per year.
We currently live in Murray County, so we're gaining 2 county residents.
We take specific action of each one during the public hearing, we have a public hearing.
I think.
Well, they're not public hearing, they're not action, right?
Any questions on that application?
Move on to the next one.
So the other aspect we received is from Lloyd's Ward. In that was. His new home only, estimated value is at $336,400, which would result in a annual abatement amount of $1,058 per year. Again, those are at the current valuation, the current rate, so that will change once it is complete and gets paid out. Because those payments will not happen until after the sun.
I see that Lloyd's application is on two different parcels. And, so it looks like,
So that was Lloyd Belts.
yes, pardon me.
Yeah.
Belts.
Yeah, his was gonna be, his home is gonna be crossing two different parcels. We did verify, talk to the city as far as which way it's gonna be facing, what address is gonna be used. We, at this point, the city is not requiring them to combine those
That's
parcels.
what I was wondering.
And we are not going to combine them if we don't have to, only because there are special assessments on both of them. The city of Edgerton did a project where they did some assessments, yeah, and so each parcel has its own assessment, and so we can combine, but it would be a lot easier if we can leave them separate. The city had said that they were not requiring that accommodation. So hopefully once that stuff is done, they don't.
And it's also a corner lot, so he gets to go around the corner to and pay him.
Oh, sure. I recall a couple years ago, we had a tax forfeit property. That was on two different parcels as well too. And when we sold it, we had to wait for time because they were on different. So would that be a possibility in the future here? Not that they're gonna forfeit on this, but. Does that cause complications in the future?
So. In the past, there was a couple that had that, but yeah, we had to wait because taxes had got paid.
I mean, I'm one party, not the other, so.
But yes, we would have to address that.
Yeah. But considering the circumstance
Yeah.
that this is a better way to go then.
We kind of preferred this way,
Yeah.
if we could.
Sure.
Anything else we need before we come out of this meeting?
I have one question. How many of these can you apply for? This is Lloyd's lot, third or fourth one.
He must be building for other people.
He is building one speculation. He's got one that's finished already, that's waiting to be sold.
And I think our policy never had any restrictions on that.
No, and I know,
No, I don't think. that-
It'll just go with whoever buys it.
Right.
they picked it up after the website,
Yeah.
as it was. I'm sure he's paying tax on the one that's finished, that's, not sold.
Sure.
Correct. The abatement kind of, it follows the ownership, so whoever applies, they apply because they own it at that time, and then when it's considered complete, and the ownership, that's who gets that abatement. So if it does ever change, if someone builds something themselves and then chooses to move later, if it's not through the 3-year abatement process, whoever the new owners are, whoever pays the tax, they're the one that gets that abatement. So.
At the end goal again is to get the properties developed, and then this is a great tool for him, so. Works well.
Anything else?
Ackman too, or is that? Is this the next step? Is that?
So that will be, that one just came in, so that will be not part of this public. hearing.
Okay.
So, come out of the, close the public hearing.
I'll support that.
Okay. Motion to second, all those in favor? Opposed, motion carries.
I need a motion, we approve the abatement for Lloyd Swart, no, Lloyd Bell.
I second Lloyd Bells.
Okay. Any discussion? Hearing none, all those in favor?
Aye.
Opposed, motion carries.
We bought those two parcels and made a little house out one.
Yeah.
With back to building a house without a basement, so it has to be spread over. That's why. The two parcels.
And I'll move that we approve Lloyd Zort's application for a tax payment.
Okay, I'll second that one. Okay. Discussion, hearing none, all those in favor?
Aye.
Opposed, motion carries.
Okay, and so, we have those three, those ones I will notify them that they have been approved and let them know that they can start
They can start.
their work. And we have a new application for a new home abatement, for Alan Hackman. And this one, we will be tearing down the old house and garage. It's gonna have a full unfinished basement and an attached garage that is not, they kind of wrote that on their plans. They just made a note about the garage, but it wasn't actually like drawn out with the house, just because at that point when they had gotten their plans, they did not know for sure what the plan was, garage. But they made a note there that they're gonna have the garage location and the size on there. They are actually having to work on a variance, and so they're gonna be having a meeting here at the end of April on that.
As a distance to the road.
Due to the location, correct. So they will be having that going on, but, so our purpose here is just, again, presenting that application, and we just have to schedule a public hearing at which you will review.
Do you have a date in mind? that you'd like a public hearing?
Yep, so we were looking at May 12th, because we won't have enough time to publish before the next commissioner meeting, so we would have to go to the May 12th meeting. 10 o'clock. It's kind of our time that seems to work, so that's what we're looking for.
Mr. Chair, I'll make that motion that we set a public hearing for May 12th, 10 o'clock, for Hackman's.
Okay.
Second. I'll second that. The location is right around the corner from my farm. It's right on the substation on 75. It's gonna be-
That'll be a nice improvement to that, to that acreage.
What was his dad's name? Wilford is grandpa. Yeah. It's on that. Yeah. Yeah. I could build a house.
Motion and second, any further discussion? Hearing none, all those in favor?
Aye.
Opposed, motion carries. Thank you.
That's all I have for now on new home abatements. We'll see if we get some more.
So good. Good morning. We had come to us for. How'd you find out?
Well, your deal found out, deal for the county.
Yeah.
Yeah.
Morning, guys.
Morning, Kyle.
So, I'll just start in right away with, our fire dampers that we have here in the building. They are pneumatic. And, we're looking at changing them to electronic. We have an old air compressor out in the, air handling room that it's a special special air compressor, and the only thing it runs is the pneumatic fire dampers. So we're looking at changing so we can get rid of that air compressor, the noise, maintenance of that, everything. And this is just a tentative or a bid of per damper. We still have to have a price on the controls through our fire alarm supplier, which that's pretty minor compared to what the dampers would be, because we'd have to take the dampers out and put in new dampers. We looked at trying to get motors, so we just take off the pneumatic actuator and put on electric motors, but that's no supplier will follow that. So we'd have to take out the damper and put in a new electric damper. We are also waiting on in the treasurer's office, we would have to open up the sheetrock. On that one, there's 2 dampers in there. And then put the new ones in and then redo that, so I'm waiting for bidding on that. I just wanna kind of put this by you guys if you were interested. In my opinion, I think this would be a good upgrade for the building, fire safety, life safety. Just wanna kind of present this going forward.
So this is per damper.
This be per damper, there's 6 dampers, so there's 1 above each elevator. And then there's 1 in the, or there's 2 in the auditor's chase, which those 2 we can get from underneath. So that's no sheetrock or anything there. And the other 2 would be in the treasurer's where we would have to open up the sheetrock and do that in there.
Yeah, I agree, it's worth the investment. I've worked with those old pneumatic dampers before, they're antiques, so.
Yeah, and our air system through this, you guys replaced in the recent past all the pneumatic controls for the air handling system. And you get rid of this, we can get rid of all the pneumatic throughout the whole building. We won't need that air compressor or anything. It is, like I said, in my opinion, is a very good upgrade. Well overdue, probably. So I'll get further bids on this. If you guys are interested on this, I will get further bids and get everything as a complete package.
Looks like it needs to be done.
Mr. Chair, if I may too, Kyle and I've talked to about the compressor that's in the fan room over here. That thing is.
It's on the
building as far as I know, and if that thing ever dies, that's probably a $6,000 to $8,000 just to replace that. That thing runs 24/7. And we're just blowing air all over the place in here from, it's not, we need it for the dampers, but it's still blowing air through all the copper that we abandoned when we put in the system.
That old money, you always see them.
Yeah, you can hear it.
Actually expensive to run, you think about.
Oh,
it.
yeah, copper, the problem is it's probably 3-phase too.
And honestly, that's another thing, like all that little copper tubing, we can take a lot of that out. Once that's done, we can scrap it all and get that put back in to the general fund. That'll add up pretty quick, that pricing.
And as you mentioned, I mean, this doesn't include the actual electrician's work to make these connections, so there'll be an added on.
Yeah, there'll be an added on price, but that's pretty minor. This is the main expense. And this is per one, so you take that times 6, and that's just figuring high. Now that if you guys are willing, we'll get a little, we'll get multiple bids. And we'll get a complete pricing package.
And you don't need to run 6 whole new home runs back to the panel, you pick up.
No, these are very small. We can pick up anything, fire alarm, any alarm circuit right there we can tie into, and it goes into a relay. These motors are powered open, so it fails shut, so fail safe. And they don't take many amps, so we can get any kind of power around there. It's pretty simple. That shouldn't be too expensive. So I will get that on our next list. I will go forward. I'll get that whole package deal, and I'll get that presented hopefully by next meeting on that. So our next objective is up in dispatch. We have issues with our screens. It's too dry, so they're glitching. And they're going blank, or they'll freeze up because the humidity is way too dry during our heating season. So I have 2 different types of estimates here. The first one is from Henniger. That one for $3,221.43. That would be just for the dispatch area. That would be a wall mounted plugged in system. That'd be estimate 1341 on top here.
We don't do that. Not like a 4. I don't know the 40.
Okay, but this one, it would be just a centralized location. It would be just in the dispatch, nothing else. And that'd be the $3,221. That's the cheapest route. Then our other option would be the whole law enforcement center air handler, and that would be centralized in our air handling room. And I have 2 bids. One is from John's Controls. So this one would be tied in with our Metasys system, our computer system, and we can control it from that. That one is $24,110. I also got another bid for the whole system. This is identical equipment. Nothing different. The only difference with Henniger is it won't be tied in with the Metasys system. We would just control it from the actual unit in the room. And that was $6,028. And that is identical equipment. The only thing that these pricings don't have is the electric hookup. So I reached out to Jares Electric. They did all our work in the back. Our panels are close for being full, amperage wise. We have enough space, but I just gotta make sure that we have enough power there to supply this. So that might change a few things, but this is just the install of the plumbing. There won't be any electrical involved with what these pricings are. I would advise, I don't think it's necessary to tighten the system. We're in that room every day. We're here. It's gonna have, it's automated anyways. It's gonna have readings, humidistats, where it reads humidity, and it'll make an adjustment on its own according to the humidistats. And all we gotta do is go with the control right there on the box that'll be in that room. We can up it or down it if we want.
You probably won't have to change it much.
Realistically, no. And I don't think with the price difference, I really don't think it's worth. In fact, we can install 4 of these.
Yeah, that's a big price to pay.
Yeah. And this is talking with law enforcement dispatch, this is kind of a high priority need during the winter months. Because when you're heating, you take all the humidity out, their screens are an essential.
They get shocked.
Yeah, well, they don't even work. The screens get so dry, they glitch out.
How low does the humidity get?
It was down, I think 10%,
10%.
8%.
Yeah, 8-10%.
That's not even healthy for them.
No, it should be 30% is ideal. And we're talking IT, they would like it 30 to 35, but our goal right now is just to get it above 20, just to get them from stop glitching. But we do have humidifiers up there, but we can't fill their whole area with portable. We have one up there and it was struggling to keep up above 15.
Then you get that line and everything out.
Yeah. So this will be a whole system. So not only will it be in there, it'll be the whole building, which will help.
The water supply for these, does that need to be RO water so you don't get that film line?
I don't know that answer. I can get that.
It might be worth looking into for the future, because otherwise it's gonna scale up.
Right, and I know like there is a descaling you have to do on these, just like you have your on-demand water heaters, you have to descale those also often. And I know with this we would have to, so I'm pretty confident they're not putting RO or anything in this. We could look at adding that to this.
It might be worth looking at.
So I'll tell you what I'll do with these. I'll probably go with the Henniger one since it means cheaper. I'll have him price in an RO along with that. And then next meeting, I'll make sure I have the electrical questions I'll answer on both these as well.
Do you have an idea of how many watts these heaters draw?
I
guess.
Yeah, I think I had that information. I don't have it with me right now. The big deal would be it's a 3-phase. I think it's 100 amps.
But they're big.
It's essentially a micro boiler.
Yeah.
It's steam, so it essentially is a micro boiler. You can consider it similar to an on-demand water heater. And that puts steam in, so then you don't have water issues, rust issues in the system.
So it's 3-phase 100 amp, then there'll be some substantial investment in the electrical stuff.
Yeah, we're right there by a panel. Like I said, we have, the main thing is I gotta make sure we're not overloading the panel.
Right.
And I'm getting a little help on that calculations. But if we don't have to update it, it won't be that expensive to get power there. Just a breaker and probably 75 foot of wire.
Because they're mounted back here in the equipment room, not in the occupied space.
Correct. Yep. So what it is, it's a system, it's a box, essentially a little steaming box, and we have a water source right above it, and then it runs lines from that unit into the ductwork, so it's not actually mounted on the ductwork, it's mounted on the wall. It's easy to work on, easy to scale.
maybe consider too, for cost savings instead of an RO, maybe there's a good filtering system instead of RO.
Yeah, I can reach out, the suppliers are really good with that. We can reach out, see what they suggest. Maybe they don't suggest anything, we just do a, descaling every so often. I'll get those questions answered, excuse me, and then.
It's just from the sediment cartridge and a line cartridge, that might be enough, but.
Right, yeah, and I'll get those questions asked, and I can have those answers by next meeting. But you guys would prefer the whole unit system instead of just the room, correct?
Yeah.
Yeah,
Yeah, I would support that.
Yeah.
And also, I agree with your contention, we don't need to have it tied in, the system can be standalone with the humidistat works just fine.
yeah, I believe it's 2 humidistats.
Yeah.
But we can install a few of them for what that is. The big thing is, I believe there's 2 humidistats, or one on the return,
Yeah.
and there'll be one in the front of the supply.
Well, this computer system is gonna rely on the signal from the humidistat anyway.
Correct.
So why put another step in the middle of.
Yeah.
Humidistat control.
It'll be the actual unit, communication, so that duct controls will tie into the unit where it's displayed there anyway.
Yeah.
So we can easily, change it and do what we need to do on
Yeah.
physically. So. Yeah, so yeah, I'll go that route then, I'll get, the water quality, filters or RO.
Yeah.
And then, I'll get the electrical on that, and then you guys are interested too, going back to the dampers, doing that, I'll get all that in a package deal. So, thank you guys.
Melissa, so you're here for Kyle?
I am. Is one, okay, there's me. The only thing I really have is the planning commission met on March 31st. Consider a conditional use permit application from Shane and Amy Cowell. They'll be operating at the Cowell Auto Parts and Salvage LLC. And they're gonna be operating a used auto parts business salvage yard. The location will be at their house, which is in Etna Township. It's the northwest corner of section 21. The plan is to have up to 100 cars stored in a location that has trees on the east and west side. The future plan will be to build a warehouse there. Most of the sales will be online. The recommendation from the planning commission was approval with the applicant complying with all federal, state, and local permits.
I'll make a motion to accept their proposal.
Motion. No second. Any discussion? Hearing none, all those in favor?
Aye.
Opposed? Carries.
You don't have anything about the, quarry or not?
I mean, I know about it. It's coming.
Well, you might wanna warn these guys that it's coming next week.
I've seen somebody.
Have you seen that? I can send something out if you haven't. Have you got the information, Steve, from Kyle?
No.
Yeah, okay.
I do have one question on this, I forgot that before.
Yeah.
Groundwater protection. Are there any rules for that as far as?
So they are working with MPCA right now because they are considered, a hazardous waste generator. Yeah. So, I know like the used oil, they're gonna be doing a furnace and they're gonna burn the oil, and so they are working with MPCA already, so. All those.
So it's sliced. Great, thank you.
And Macquarie will get you that information. We can work on that.
Thank you.
Okay, thank you.
Thank you.
Dean.
Hello.
That's about mile and a half. West of 23.
Yeah. A little bit south of Brooklyn is the west. Yeah.
Yeah, I went over our picture, they're hanging out, get to us. See the shadow more than the tower. Yeah.
Yeah.
Hi. I'm just coming in front of the board to see if I can do a out of state travel. Vanguard is having a commercial and industrial
evaluate, but that they're teaching you how to enter it into Vanguard. And since I have not learned that yet, I would like to go to that. That's either in Grand Forks, North Dakota, or Cedar Rapids, Iowa. They're about a horse a piece as far as, I think Cedar Rapids might be 20 minutes longer, but.
I mean, why does this make a difference for your schedule? Which one should you go to?
I wanted to go to the June, it's third and fourth on, they have third, fourth, and fifth on my registration, but fifth is, test day, and I don't have to, because Iowa has to have test, and I can bypass that, but, it just made it a little bit easier for me.
So that's the Iowa one and two?
Yeah.
Okay. Good, sure, I'll make that motion to the out-of-state travel for treating Iowa. That's good.
Further questions?
Jean did come to me first on this, and I did mention, I do support this as well, and had her do a report, for the request of the board.
And I did reach out to them too. They only offer it in Minnesota every 4 years. They just had it in 2025, unfortunately, before I started. So that's why I'm like, well, if it was next year, I'd wait, but yeah.
It's not that far. What part of Iowa did you say?
Cedar Rapids, so.
2 hours.
Yeah.
8 hours.
I think it's
How many?
probably
8?
Oh, I was thinking it was 5.
It's farther than you think. Yeah, it is. You'll find it.
Chicago was 8.
Put it down on Google Map.
Yeah, exactly.
Yeah.
How fast you guys drive?
No, Chicago is 8 hours.
About 5.5.
5.5?
Yeah.
Have a motion on that?
We have a motion.
Yeah,
And second was, Doug, thank Doug.
All those in favor? Opposed? Carries.
Well, I just want to go, it's just right north.
Oh, there you go.
Been there last time.
Yeah.
I'm gonna drop her off and pick her up.
Yeah, pick her up.
I didn't hear that. That's good. All right, thank you.
Boats are better now than they used to be.
You want to go right into committee reports, you want to take a stretch? Up to you.
No, either way.
Won't wait for Doug. This Shady Powell site, that's a Susan, all right? I've spent
Okay.
many hours at this site.
Okay.
One of our 2 megawatts, one of our first SMEs.
I suppose we could recess for a couple of things.
Sure.
That's fine. Okay. Good.
You think you could ask you?
Reconvene and we're about to committee reports.
I'll go.
Doug, okay.
Let's see, March, front to March. On the 10th regular board meeting. So on the 10th, road and bridge committee meeting, mostly was discussion on the 25 project. On the 12th, oil and water meeting. 16th, private industry council, March. The 18th, health and human services marshal, 20th, the board of consultors, for Avera, that was at Sioux Falls. This, I guess just being Brad, were there for professional. 24th, regular board meeting, PCMC in the county. 25th, radio board meeting in Marshall. 30th, extension meeting. And then the 31st, the Avera education session at Sioux Falls. Report. Okay. I'm ready. And March 9 was a report to the Edgerton City Council, just some of the things that are happening in the county. It wasn't a per diem meeting or anything. And had another one of those on the 28th, a hospice benefit. Did you ever hear how much the hospice benefit raised?
No, I did not.
Sometimes that takes a while to get ready.
I'm very well attended. I thought it should.
Yeah. Some people later that couldn't get tickets.
Yeah.
Yeah, back quicker.
Nice problem to have.
Better than working to an empty room.
Yeah.
10th was a regular meeting. 18th was library, us executive meeting. Another meeting in that Wednesday night. The third Roman Facility Energy Board. So Zoom 24th regular meetings. And the hospital board meeting, same day. Our first planning meeting in Sioux Falls. Yeah, that was nice.
My month of March, started out then with, Prime West on the first Thursday, then the fifth. Again, Jim Prisball's retirement is gonna be this next Thursday coming up here, on the second. So I think you guys are all, I think an invitation went out to all four, they're all commissioned in it.
Believe so.
Yeah.
There's a celebration for him then.
Okay, so it's gonna be after the board meeting. Yeah.
It was May 7th. They get to the.
On May 7th. Yeah, on May 7th, yeah, we got a little bit of time. As far as Prime West, mentioned a little bit, still, they talked about the, non-medical, non-emergency medical transportation. And we talked about this company where they just developed or discovered the fraud from. They're still in litigation with them. One of the assets they have is their software program that we might be interested in, but it's getting drug out so long. Then there was the clawback by the state that the state was gonna take that transport. At the last meeting, Jim thought it sounds like they're going to carve that out and they're not gonna take that, it'll be left back to us, so it's really up in the air right now. Whether the state's gonna administer it or we're gonna do it ourselves. Even if we don't do the transport, Jim said that we could still use that software for other scheduling. So there's some value there, if we don't have a job. The other thing I had then. So on the 9th, Luke and I had our plan house at the hospital. Wednesday, the 11th, I had a Veterans Memorial Committee meeting. The showing has been ordered and received. Now we're trying to finalize the names. They want to carve as many names as they can down there. Their plan is cheaper to carve them there when they set them here. And they're hoping to have something set probably by Memorial Day, to have some of the facility put together. Still discussion on flagpoles. They're looking for individual sponsors for the flagpoles. I think we're gonna 9 of them all together out there, so. The next one I had then was on the 12th. We had our Casey Jones meeting on the 12th. Biggest part of that was planning for this gala fundraiser that they just had last week at Hadley. I wasn't able to be there myself. I understand that, good program, great music, good turnout. So I think we'll probably do more of that in the future. Next one then was on the 18th of Southwest Health Human Services. And again, Doug, our report was done for us, so it's good. It was nice.
That was good, yeah.
You got good people that are very fortunate. Yeah.
Found it interesting that they were moving to purchasing cars versus leasing.
That's something.
It was, they had a big deal on
Yeah.
that, like figuring it out.
Yeah.
It was cheaper.
Especially during COVID, because we had leases during COVID, so those cars sat there getting no miles on them. And we could actually buy them back from the leasing company at a fairly reasonable price. So. I had my SMOC meeting down in Worthington on the 16th. Nobles County Library, they have their facility done, so they're moved out of the SMOC building they rented from. So it's kind of nice to have that income for a little over a year or so. But we're also, some of that space we got left out there, they are redeveloping it for like a community resource center type thing as well. So there are plans for that. And we've got another building on 10th Street that we're not using anymore. So we're gonna go ahead and sell that one and consolidate it one. Well, we'll have, of course, the Head Start building and then our SMOC building. And speaking of Head Start, that application process and for our facility here, it now, we had to go back through everything from zero with groundwater soil testing and environmental impact, all that. So we jumped through all those hoops. And of course, our architect and engineer estimates are much higher than they were before, so those all been resubmitted. And we've actually made it through the first approval process, so now there's only one more approval after this, so maybe it's gonna get done.
Did you have to do archaeological?
That's already been done, it's been done a couple times. And I asked Darcy Yetke as our director down there, and I shared with her my decision not to continue in governance. And we also have a citizen, we actually have two citizen liaisons on that, and Evan Schiller's still in one right now. And he is termed out. So I asked Stacy if it'd be possible to extend him until December. So in December, then if I could take his place, because I can stay on that board, of course, that would be with this board's approval for that. Stacy said she'd be all for it as well too. That way I feel I can maybe help get this thing finally finished. We've been working on this for 8 years. Why does it take so long to get anything done? So that's kind of my plan going forward to get that thing wrapped up. I think it's gonna happen.
Well, you throw in a pandemic.
Yeah, why not? And Steve received an email then from the monument from helping with her name, Lauren, basically all concerned about water runoff and light pollution. And it's kind of the same things that she threw up at us when we worked on the dental center out there as well too before. So we'll have to deal with that as we go forward. So, but
The issue she was concerned about was the transit building, the proposed transit building.
Yes. Yeah, we're not even on her radar yet. This is the transit building that she was asking about. Yeah.
And I believe I think put in your box, there's a hearing on the 13th at City Hall regarding the permit for the smart.
Oh, there is.
Yeah,
Okay.
yeah, I threw that, you got it in your box. Yeah,
For the bus barn, not for the slot building.
smart.
Oh, for the slot building. I did was.
So bus barn, I haven't heard anything lately where that's at. Have you, Dallas, heard anything more about it?
By the dental center.
Yeah, that's all.
Yeah.
Yeah, that one.
Yeah. So that's gonna be on May 13th, Wednesday.
Bingo.
Yeah.
Okay, I'll have to make sure I'm there for that.
It's an evening one, isn't it? It's sitting on my desk. I never had it.
No, that's fine. It's in my box.
Yes, you got it.
It's coming up. So that was my smock, and then the only one I had then was the Wilderness Energy Board. Yeah, sorry, talked about, and kind of the hot topic there, they keep talking about this data center stuff in Nobles County. And now we're hearing a lot more about nuclear energy, they really want our support for nuclear energy. So I don't know.
They turned that down so far. My nephew, brother-in-law, they live near there.
In Nobles County, yeah.
Is the planning commission, is that who was doing it first?
I think
They
the Nobles County,
didn't
Nobles
approve.
County planning.
They did not approve.
okay,
Oh, really?
But the board,
yeah.
county board can't approve it.
Yeah. And I get the impression, well, you Dallas, that they're looking to us to help recommend it, and I'm not willing to do that. I just don't. I understand it's load, but is it good?
They're gonna have to generate their own.
Yeah.
As much as they take.
Yeah. Then we had, guess that was about it. And you talked about the road and bridge here and so forth already. Coming up, actually, it's tonight. Our base volunteer appreciation is tonight over at the beach, and so if you guys have time, I've got reservations there, so be good. In fact, I got to go help Bonnie with the keyboard over there, Frog, so Frog's gonna perform tonight. That's all I've got for this month, thank you.
Okay. On Tuesday, the 3rd, MRC, we heard from Senator Rob Kupak and Representative Bianca Bragg. Senator Kupak had bills, trying to address radar gaps in weather forecasting, protecting farmland from solar projects, and regarding e-waste and battery bills. Representative Vernick mostly spoke about, larger ask for modernization for health and human services. Then at the beginning of the AMC conference on Wednesday the 4th, we heard from Senator John Hoffman, who of course spoke about being shot. And I mean, had a pretty positive attitude considering he spent about 6 weeks in ICU and.
Shot that many times and survived. That's amazing.
It is. Yeah. But yeah, he was a very impressive speaker and whatnot, and then later in the day, we visited Senator Weber and Representative Schumacher. Both of whom, of course, are retiring along with everyone else in Southwest. So, I think they're up to 42 now, that are retiring or seeking another position. So, there'll be a lot of education necessary going forward. The Environment and Natural Resource Committee, Dave Dressler from the Sewer County was elected vice chair, and then we heard from a number of agencies. Bowser spoke about future rulemaking on intermittent and perennial water courses and the implementation of high priority areas for wetland replacement. DNR mentioned having an RFP available for maintenance for trails. And somebody from.
If you build them, you gotta maintain them, you know?
Right, but apparently they do have a pile, or at least, a bucket of money right now that they're taking applications, so. Somebody from this area should consider exploring that. And then we heard from some people from Minnesota Climate Innovation Finance Authority. They're taking RFPs for energy saving projects such as microgrid electric service at schools for emergency weather events. And one they funded was for an electrolyzer at the Burnsville landfill to take biomass and turn to biochar.
Yeah.
Seems something works apparently. And then of course, at the AMC board meeting, we talked about that sales tax for Hennepin County to fund the hospital and the stadium upgrades. And NACO mentioned, there's a new transportation bill to replace the IIJA coming out in September, and keep an eye out for it to see what's different or better or worse.
Both administrators for Hennepin County Medical Center have resigned now.
Really?
Wow,
Really?
Wow.
Did hear that.
They had co-administrator, why do you need co-administrators?
Yeah.
They're great. I didn't understand that.
Well,
But
either that or it was just, it depends what you wanna call it, I guess. Right.
one was only on duty for 4 months, so.
A mess up there.
Did you hear on the news this weekend that incinerator up in the metro area? That there's protesters up there that want to shut down immediately, they don't, cause I think
Right.
it's scheduled for like a year and a half now or something like that, isn't it?
Yeah,
They want to shut down immediately.
and they still are claiming it's polluting the neighborhood, and it is absolutely not.
Yeah.
I mean,
And the article I read said that right now, that the Hennepin County sales tax is 0.7 cents. And they propose increasing it to 1.5, 0.7 to 1.5 to make up for the lost revenue from that incinerator.
Oh,
Or
wow.
to pay for the extra cost.
but I'm still wondering, it's my understanding if that closes, all 3 landfills in the Twin Cities will be full in 3 years.
Yeah.
Then what? And the one in Burnsville is already taller than Buck Hill with Ski Hill. So right next to the river.
Same.
The snow won't stay on it.
Exactly.
It'll generate enough heat if the decomposition or melt the snow.
Right. And 6th at Area 2 in our CRCA was pretty routine there. On the 9th at Planned Ops, and then one watershed, one plan for the Redwood River, where we approved the draft policy and budget for the plan. The plan was approved at the March 25th Bowser board meeting, so since, they've applied for the money and allowing them to do projects. On the 10th at the Road and Bridge Committee here after our regular meeting. On the 12th at the Soil and Water District meeting where they approved our CPP contracts and soil health delivery grant. On the 18th, Highway 23 Coalition met to finalize plans for the April 10th annual meeting in Mora. On the 23rd, Regional Solid Waste Commission was fairly routine, was same issues we always have in there with the devil landfills and whatnot. At the hospital board on the 24th, 25th through the 27th at the AMC Leadership Conference. Steve and I were both there. And then had that education session on the 31st in Rivera.
You mentioned the solar moratorium. I've been hearing more about that as well too, and what they know about it, what's the ask there.
I think it's, the only thing I've heard is that they're trying to not have solar projects placed on,
Farmland.
farmland.
Yeah, and I don't know who's pushing this. And I don't know, they haven't come to us, so we're gonna say energy more about this yet, but
I know Senator Kupak was one of the authors for a bill regarding that.
Yeah.
He's from Clay County area, Morgan area.
Forget the public hearing, planning commission, public hearing, council chambers, municipal building, Wednesday, May 13th. And that is for the Head Start.
Okay,
And what time is that?
Evening, right?
5:30.
5:30,
yeah, May 13th is a Wednesday, at
Yeah.
May
5:30.
13th at 5:30.
Okay,
There
good,
you go.
I will be there.
Anything else to come up today?
Just she talked about the opioid settlement a little bit where the money that has been sent down to us has not all been pushed out yet, but some of it is because there's long distance programs, there's not in the bank. Yes, because one of them is to get more drug DAC people, drug awareness counselor or whatever. So, you know, it's a 10-year program, so that money is still in the bank, but it's designated for that. And try to make a difference of where we spend the money on billboards for awareness and drug dogs, really whole variety of things. And I'm sure some counties think they're behind, but you know, a lot of this stuff rotated. Depends on one county.
Right.
You get our health and human services meetings, the one I think of Lincoln County Commissioner. He questions the billboards a lot, about every time that comes up, whether that,
Whether we're fine,
well, how do you know?
you know,
He always brings. Where, you know. You gotta do something with it, you know, to try to help.
Right. Have we heard any more on the dispensary or?
I have not heard anything back from the gentleman that came down to visit the Holland area. I had a talk with Ken Wilbur yesterday on the phone.
Okay, so that's on the grow up, right? But on the dispensary uptown,
I haven't heard anything on when it's
because they'll have to get a license from the county, won't they, the city, the state?
city.
Oh, yeah.
City and state,
Right.
which is like liquor. That was the one license the city had, and we still have one license in the county.
But we can't count the city one as our one.
No. We could have, if we want to go back and amend our ordinance.
and did you guys understand that Laverne has got 2 open dispensaries now?
Three, I think.
Three of them open.
And I think there's more than one. Oh,
They have 3 open right now, and I think they're going to 5.
that's what I've heard.
There's 2 more coming.
I don't know how much business I think they're gonna get, but
We don't open a house for one of them, like, so. Might be open house is, but for
good.
And again, kudos to our law enforcement people, you know, you read the paper and go into that, there's been old drug problems in our county, well, okay,
maybe more in the open than.
yeah.
Hey, anything else for today or?
To adjourn.
Second.
Okay, all those in favor?
Varies.
It's official meetings later, is there a second?
Please. The second.
You gonna run again?
Second.
When do you have a file?
Say 19th to June 2nd.